Hi, this is Wes Stevens, Director of Clinical Services. Coming to you today, we have a patient that is called in, wants to come into the office. She was set up 2 nights ago. Last night she had some air blow in her eyes and increased pressure intermittently. Kept her awake, and then she wants to come in and talk about it and see what her options are. So today we're going to go over her mask that she wears, the software that we have to be able to tell how she's doing in that mask, and then we're going to try to give her some answers or some correctional steps that will help alleviate that leak that she's having. So this patient ended up choosing the N30I Nasal Mask by Resmed. It has an adapter up on the top. So this, sometimes people like this where they don't get tangled up in the cord as much. So this mask strictly blows the air up into the nose, comes with several different size cushions that your therapist has fitted you for the correct size. So our main complaint again is the pressure started off okay. It got really high intermittently through the night, high enough it was blowing up in my eyes, keeping me awake. I could go back to sleep, and then it would start the process all over again. And I'm more tired. She was more tired now than she was before she started using CPAP. So we're going to look at the download on this patient. And as we can see, this patient went to bed. This is the mask leak up here. This little dotted line is the unintentional leak limit. On the Resmed machines, anything above that line, the pressure is not optimal because the machine is not able to keep up with the leak, and therefore the pressure within the airway to splint the airway is not effective. So this patient started off very well. As we can see down here, the pressure spikes up due to an apnea event she had. As the pressure spikes up with the apnea event, the leak goes up because her mouth has come open during that period. She's open, blowing a little air. She comes up to subarousal. The pressure drops because the apnea event is over with. Her mask leak drops back down to normal. She goes to sleep for just a little bit, and then again she has another apnea event, a spike there that spikes up the pressure, which also increases inner pressure within the oral cavity here and kind of pushes open the hinge on her mouth. And then she wakes up. She keeps her mouth because she's cognitively aware that she's awake, and she keeps her mouth. She lays in the bed for 3 or 4 hours, and then she says she tries to fall asleep again, and then she has another apnea event. Pressure spikes up. Her mask starts to leak. She takes the mask off. At that point, she's pretty frustrated. So we can see what's going on here with this patient. So we have identified that the problem appears to be that the mouth is coming open at nighttime, that this patient is most likely a mouth breather or may have some congestion, sinuses, allergies, may even have the flu or even possibly COVID and have some inflammation up in the upper airway there. So our solutions at this point are we could introduce a chin strap with this patient's nasal mask, and that would be to help keep the mouth hinged at night with sleep. That's one possible option. The patient may still open the mouth or have a little bit more difficult time breathing. The second option is we could switch to a full face mask. That way, if we do have some upper inflammation in the nose, air will take the path of least resistance. It will go through your nose or the mouth, decreasing the overall pressure that's directed up into the nose, and the mouth will not come open with a full face mask if it's fit properly. So we discuss these options with the patient, and it's always up to the patient what they would like to try, and then we'd go forth, watch them for a night or two, see how they're doing with their leak, and then reach out to the patient, discuss it. If they're doing great, we'll just keep watching them. If they're still having some leaks, we can try to make some other arrangements, either go to the full face mask and treat the allergies effectively. And again, all this information is not meant to be medical advice at all. This is just some educational hints that hopefully will help you out in your journey with CPAP.